Hello, I'm David Heath. I'm co-founder and CEO of Litehouse Health. If you or I were to go out to Spokane Airport right now, we'd see nurses flying into Spokane to work, and we'd also see nurses leaving Spokane to go work in another city. And all of that cost ultimately gets borne by us, the consumer of healthcare. So you've got local nurses who are coming through COVID, they're stressed, they're working hard, it's a tough environment, it's a tough job to start with, and now someone comes in from Cleveland who's gonna live in Spokane for 13 weeks and make 2.5 times what they do. That's demoralizing. So what do? We realize that, okay, there are a lot of local caregivers, one that would work more if they could. So for example, a nurse who works, let's say at Deaconess right over here, he or she's gonna work on average 3 12-hour shifts a week. But they're not gonna work more than that because that's overtime and that's expensive to the health system. So they're trapped. They can't, for example, go pick up a shift at Sacred Heart, the rival hospital, because of all the credentialing, background check, getting provision on their electronic medical record. There's a lot of hoops. There's a labyrinth to work through. Well, what if we put technology to the task, right? Think Uber instead of a taxi, right? Uber goes out, unlocks local folks who can drive, does the background check, checks the licensure. We do that and a heck of a lot more to make sure a nurse is a nurse. And then we meet the hospital's criteria of what they need, their spec for a nurse to work. And now local nurses can work multiple locations. They can pick up an extra shift a week or whatever they want. And that's what's really important too, is it's on their terms. How did we really put this together? I've been working for a company that was dabbling in this space and had been in healthcare executive sales for 30 years now. So I had seen this space potentially work well. And so I reached out to Dr. Ellen Kunert. She and I used to work together all the time. She's a wonderful person, very, very bright. And I ran the concept by her. She's like, oh no, this could work, provided with the right technology. So then we turned around, we had to find our technology person, and Justin Shaper, who I'd worked with at Intermountain Healthcare, just a genius of a guy. And Justin's great because he can build what you want. And so Ellen was really able to lean in, and the marriage of the two helped create really an app built by nurses for nurses. So how did we get liftoff? And it really started with the encouragement from Tom Simpson. I myself had never been the tip of the spear, and I didn't know if I really had the guts to go to the other side of the hill. And Tom really got me there. But really what we've discovered is Spokane's been exceptional. And whether it's Ignite and whether it's the Spokane Angel Alliance, the community of business-minded people who want to invest and see others thrive is amazing and special in this town. And the support far exceeds any of my expectations.